Welcome to the Rio Rancho Public Schools Training for EpiPen Administration. This presentation was developed by the Health Services Department to train school personnel in administering epinephrine in an emergency situation in the absence of the school nurse. Like CPR, the prescribed medication, epinephrine, can save the life of someone experiencing a severe allergic reaction. We hope this training will prepare you to administer an EpiPen safely and confidently before emergency personnel arrive to transport the student. I'd like to take a moment and thank all the folks that helped with this presentation. The nurses in the Health Services Department have provided wonderful assistance and contribution to the content of this training. The goals of this training program are to recognize the warning signs of a severe allergic reaction. Secondly, to accurately identify the student for whom the EpiPen is prescribed. We want to make sure that we are giving the correct medicine to the correct student. Next, you'll need to be aware that students who have an EpiPen have a health management plan which contains information on the student's condition and how to help that student in an emergency. It will be important to follow the directions on the student's health management plan. Lastly, we'll show you how to administer the EpiPen safely. So let's understand what happens to the body in an allergic reaction. The body responds to allergens by swelling. With severe reactions, swelling occurs all over the body, especially in mucous membranes such as behind the eyelids, in the mouth, and in the nose. When swelling occurs, airway passages become blocked and the body is unable to get oxygen, which will ultimately result in death. This is a bad thing generally. What can we do? The best thing to give a person who is suffering an allergic reaction is a drug called epinephrine. This is a chemical that quickly constricts blood vessels, raises blood pressure, relaxes smooth muscles in the lungs to improve breathing, stimulates the heart and increases the heartbeat, and finally it reverses hives and swelling around the face and lips. In an emergency situation, there are no reasons not to give EpiPen to a student. In other words, there are no absolute contraindications to the use of epinephrine in a life-threatening situation. So let's talk about EpiPens and how to take care of them. EpiPens must be stored at room temperature. Exposure to extreme temperatures can chemically alter the medication and cause it to become ineffective. Do not freeze or refrigerate EpiPens, or expose them to sunlight or heat. Lastly, check the package for an expiration date. Over time, medication can become unstable. EpiPens should be used or discarded before the manufacturer's expiration date listed on the medication package. This date is usually located on the side or end of the package. Before you administer an EpiPen to someone, be sure you think about the following. Before using the EpiPen, if visible, you should check the appearance of the solution in the pen. It should look colorless and clear. You want to make sure that you inject the EpiPen into the student's thigh muscle. Accidental injection into any other area besides a large muscle will require immediate treatment by a physician. After using an EpiPen, the auto-injector should be placed in an impermeable container and given to EMS personnel to transport with the student. Before giving any medication, RRPS staff should triple-check the medication information. First, do you have the right student? Then, are you using the medication that has been prescribed by the physician? Does the dose on the box match the dose prescribed by the doctor? Next, you want to make sure that you are administering the medicine the way it's supposed to be given. That means if it's supposed to be taken orally, do it that way. If it's supposed to be injected, use that method. Lastly, is the time correct to give the medicine? In an emergency situation calling for the use of an EpiPen, this is determined by the symptoms the student is exhibiting. Let's take a minute and talk about what each of these criteria mean. First, you make sure that you identify the student with the severe allergy by matching the photo on the student's health management plan to the student. Identify yourself to the student and let him or her know you will be helping them in the event the EpiPen needs to be administered. Ask the student the source of the allergen and give this information to EMS personnel.
Next, let's make sure you're giving the correct medicine. An EpiPen auto-injector is a prepackaged syringe and needle containing epinephrine. This packaging saves time when administering epinephrine in an emergency situation and is easy to use. Notice that each end of the EpiPen is a different color. The orange end contains the needle used to inject the medicine, so don't remove it. The other end is a blue safety cap that you'll remove to activate the pen.
Our third consideration is that we know and administer the correct dose, the one prescribed by the doctor. Just so you know, an EpiPen comes in 2 different doses, and the one you use for a child has been predetermined by the doctor according to how much the student weighs. An EpiPen Junior contains a 0.15 milligram dose and is for students under 66 pounds. A regular EpiPen contains a 0.3 milligram dose and is for students over 66 pounds. The child's physician will prescribe the correct dosage according to weight. A new EpiPen autoinjector has been developed which contains 2 doses of epinephrine. The plastic box that contains the EpiPen clearly states Twinject. This EpiPen contains 2 doses of epinephrine. Directions for use are located on the Twinject syringe. An initial dose is administered. If the child's symptoms do not improve within 10 minutes or get worse after that time, you can administer a second dose according to the directions on the auto-injector. A second dose may not be required. The second dose cannot be saved for use at a later date, and the auto-injector should be discarded appropriately. Approximately 1 in 3 people may require a second dose. The fourth consideration is that medicine is administered correctly. Epinephrine causes constriction of the blood vessels, so it's very important that it's administered into a large muscle. Accidental administration into a small muscle requires immediate attention by a physician. The auto-injector can be administered through clothing, so there's no need to remove a dress or pants. Lastly, the signs and symptoms of a severe allergic reaction are listed in the student's health management plan. Your school nurse will be contacting those staff who have direct contact with the students identified as needing an EpiPen. Each of those students will have a health management plan that the staff should read and understand. The health management plan will identify what symptoms to look for, and you should review these symptoms so that you will be able to easily recognize them in case the child becomes exposed to a known allergen. Early recognition of these signs is important so that the medication can be given quickly. So what kind of symptoms might you see? Here is a list of things that might happen during a severe allergic reaction. You might see hives on the student's body. Hives are raised red rash, which often itches. They are irregularly shaped and sometimes described as blotchy, and may be warm to touch. Watch for hives to appear on the student's trunk and chest, around the mouth, eyes, or all over their body. You may hear the student wheezing. Wheezing is a high-pitched sound made when breathing in or out. This is an indication the student's airway is closing due to swelling. The student may also have difficulty swallowing, experience tingling or swelling of the tongue, and have swelling in the face or neck. These are indicators of an emergent situation that needs immediate attention. Vomiting is another reaction seen when someone is exposed to an allergen. Lastly, watch for signs of shock such as paleness, gray color, clammy cold skin, loss of consciousness, or other child-specific known symptoms. These symptoms are a critical indication that the patient will soon stop breathing. Action should be taken before these symptoms have a chance to appear.
Okay, so you see the symptoms and you determine that it's time to take action. Use caution when removing the EpiPen from the protective plastic case to avoid accidental sticks. Never put your thumb, fingers, or hand over the orange tip. Be prepared to administer the EpiPen before removing the blue safety cap. Administer the medication with the student lying or sitting down. The medication may easily be administered through clothing via the needle under the orange tip. So now let's understand how to actually inject the medicine with the EpiPen. If you need to, you can look at the directions on the EpiPen insert, but basically, here's what you do. Form a fist around the auto-injector, the orange tip down. With your other hand, pull off the blue safety cap. Hold orange tip near outer thigh. Swing and firmly jab the pen into the outer thigh so the auto-injector is perpendicular or 90 degrees to the thigh. Hold firmly for approximately 10 seconds to allow all the medication to be administered. Does your student have the new AVQ auto-injector? This is a device that has a voice that talks to you, telling you step by step how to administer the epinephrine. Just follow the verbal prompts the device tells you. Here are the basic steps. First, just pull off the red safety cap. Then, place the black end against the outer thigh and press firmly and hold for 5 seconds. That's all there is to it.
Activation of 911 should occur as quickly as possible. If you are alone, give the medication first, then call 911. If you have assistance, activate 911 as soon as the signs of an allergic reaction become severe enough to warrant administration of the EpiPen. Carefully place the used auto-injector needle first into the storage tube of the carrying case and screw the cap of the storage tube back on completely and send with the student to the emergency room. So what does the medication do? The EpiPen buys you 15 minutes of time. EMS should be called as soon as possible to continue emergency care. EMS needs to know when you have administered the EpiPen in case symptoms return. Be sure to notify the student's parent or guardian as well as the doctor about the incident. To protect the student's privacy, do not leave messages with anyone other than the parent or guardian. Confidentiality is imperative. In addition, miscommunications must be avoided. The parent needs to be reassured the student is being cared for by EMS personnel. Send a school representative with the student to the emergency room to wait with the child until the parent can arrive. What if the student is on a field trip? You'll need to notify the nurse at least 2 days in advance of the pending field trip and review the student's health management plan and get any questions you have answered. Let the student know that you will have his or her EpiPen and will be available to the student throughout the field trip in case of an emergency. Assign a buddy to the student for additional support. And be sure to have a telephone access at all times while off school property. Now let us consider a possible scenario in your classroom and think about how you would handle it. You are a teacher in charge of a class and you have just taken them outside for a math problem. You have a child with a known allergy to bees requiring EpiPen administration. You have received a copy of the student's health management plan and have talked with the nurse and understand the information given in the health management plan. In the middle of the lesson, the student with a severe known allergy to bees gets stung. What steps will you take? In the diagram to the right, you can see the steps that need to be followed in our case study. Hit the pause button if you need to take a moment to study it. First, observe for signs of allergic reaction listed on the student's health management plan. Send a colleague for help and have the student lie down. It's always advisable to give the EpiPen while the student is sitting or lying down. If the signs indicate that the student is having an allergic reaction, it's time to give the EpiPen. Administer the EpiPen according to the package instructions. After you administer the EpiPen, you will monitor the student's symptoms. If no improvement is seen, a second dose of epinephrine may be necessary. This can be a second pen or a twin jet applicator. If breathing becomes impaired, be ready to initiate CPR with the student. Okay, that's pretty much it. This training is good for 1 year and must be repeated annually to remain current. You can take the online training again in a year to satisfy this requirement. It is recommended that you practice with the EpiPen trainer and your school nurse periodically throughout the school year to stay current on these skills. After completing this training, you'll need to contact your school nurse to practice administering an EpiPen with an EpiPen trainer. That way, your school nurse will know that you've completed the training and have practiced with the actual equipment. Now it's time for a short quiz. This quiz will help you review the important points of the EpiPen administration. Be sure you don't exit the quiz in the middle, as it will score you as incomplete and won't let you retake it. The quiz is not difficult, so relax and just choose your answer on each slide to proceed.